is starting consults today for rheumatology and endocrinology. I already forgot I was doing a day vlog today, so I'm still home. It is 8 a.m. Oh, lighting. This will never be regular. It's just for consult service. I texted both my attendings. Only one replied and said that they're homesick. So I just called them with any new consults. I checked Epic at home. Gotta love that remote access. There are no new consults, so that's great. The other attending, so it's rheumatology and endocrinology, two different attendings that I have to coordinate with. I haven't heard from the endocrinologist just yet, but there are two new consults. I took a look at both of them. I'm heading into the hospital now. I'm dressed like this. I'll change into scrubs when I get there. I gotta change my white coat too, because obviously I got a stain on it because I'm a child. But I will pre-round on those patients, and I'll check on the previously consulted patients to see if there's anything we need to follow up on. So I'm in the basement right now, and I have to go downstairs to the cellar. I'm gonna trade out my lab coat and see if I can get a pair of scrubs here so I don't have to go up to the scrub machine. That was a fail. I can only trade white coats down there. I have to go to the scrub machine. More construction everywhere. It's so awkward to record when I'm actually doing things in a room with other people, so I'll just give you guys the updates in these in-between staircase walks and things. Just had to go here to get my second shot for my hepatitis B. My titers are a little low, so they're just giving me a booster, I guess. Have to get my blood drawn afterwards. Just a little interruption to the day. I could only do this on consult service, clearly. Okay, where did we leave off? I've been doing a lot of chart reviewing on the patients. I had to find the H&P, find the progress note, find out how the patients are doing. Because when you get a consult, sometimes it's not the day one of admission. The patient may have already been here for some time and now you're consulting, so you have to kind of play catch up. And then I went to go see the patient, do a physical exam. I handled rheumatology first because I only have one rheumatology consult. So went to go see that patient, examine them, wrote up my note, came up with a plan. That's the tough part, coming up with a diagnosis and a plan. And then I called the attending and presented the patient to the attending. We need to do a procedure called a joint aspiration on the patient. Noon conference is conveniently canceled today, so I have time to see the patients from noon to, let's say, 12:50. And I have to call the attending at 1, present the patients. There are 3 patients right now, and go over the plan. That's the, oh man, I think I just said this actually. It's the assessment and plan. Like, have I looked at everything? Have I ruled out have I thought of every possibility? Have I ruled out certain things? What do I need to do to rule in other things? Etc., etc. For the 2 consult teams that I'm on, rheumatology and endocrinology, there's no senior assigned. There are seniors I can go to, of course. They never just leave you stranded, but it's just me communicating with the attending, so that's super intimidating. I really need to stop exaggerating what these encounters with attendings are going to be like. He was nice. He was friendly. He taught me stuff. He drew diagrams on my papers. It was great. So, consult service ends at 3 p.m. This is awesome. It's 3:15 right now, and the only reason I'm leaving this late is because my friend needed help with an ABG, which is, I think I said it in the last vlog, an arterial blood gas. You have to stick the patient in an artery. Most likely the radial artery. Every other artery leads to more complications, so just go for radial. And I have experience with it, so I went to go help her with that. And now I'm out, riding home. All right, guys, lay with me for a second. Let's go over the consults that I had today, because I don't think I really mentioned the specifics during the day. So one rheumatology consult, patient complained of a painful right knee. The knee was swollen, warm, erythematous, tentative palpation, full range of motion, pain with movement, passive and active. So we are going to, long story short, I'm just going to keep this real short. The plan is to tap the knee, which means a joint aspiration, which means aspiration, sucking in a syringe the synovial fluid, which is the fluid around the joint. From that, or with that fluid, we are going to test it for organisms. We're going to test it for crystals, for white blood cells, and red blood cells. The differential list is hemarthrosis, septic arthritis, and gout. So far, I mean, there's others, but those are what we're testing from the synovial fluid. Okay. Endocrinology was my second set of consults for the day. One person, hyperthyroidism. Basically, their thyroid gland is shooting out too much thyroid hormone. Patient state they were non-compliant with medication, which you gotta appreciate. An honest patient. Would have been pretty cut and dry. Radioiodine therapy to ablate. Oh my god. Okay. Oof. To ablate the thyroid, make them hypothyroidism, and then treat them with Synthroid. Hypothyroidism is much easier to manage than hyperthyroidism. However, it was not cut and dry because the patient stated that they had 2 syncopal events. That means you have to do a syncopal workup. You need to find out the etiology of this syncopal event. Syncope means fainting. So it's not so cut and dry. All of those workups need to be done before we can move forward. And most likely her radioiodine treatment will be outpatient because she's not going to stay in the hospital long enough. The last endocrine consult I had, it was just 2 and then some follow-ups. So let's just talk about the new ones. It was a new onset diabetes, most likely diabetes type 2. Really, it was just a conversation about treatment. The patient started on insulin, as is all newly diagnosed diabetes, but she'll be discharged with oral medications. And that was it really quickly. I got home hella early. I was able to chill, eat lunch, dinner, afternoon snack, eat it. I went to the park. I played tennis. Like, you know those like walls where it's like the length of half of a tennis court and then a wall, so you just like hit the ball against the wall. So I did that. I'm really bad at it, turns out. You'd think it would be easy. It's not. And yeah. Thanks for watching. See you guys tomorrow.